I had a 49-year-old female who 2 years ago, she was diagnosed with stage 1 T2 and 0 sigmoid colon adenocarcinoma. She underwent resection, 26 lymph nodes were collected, and those were negative. And she went on surveillance afterwards. About 3 months ago, she developed new rectal bleeding. On repeat colonoscopy, she was found to have recurrence at the site of anastomosis. She underwent re-resection. It was a T3 and 0. 16 lymph nodes were collected. The margins were very close. No further resection can be done because of adhesions from her previous surgery. And she was MSS. So now we have local recurrence in a young lady at stage 2 T3 and 0 colon adenocarcinoma. And the question becomes, will she benefit from adjuvant chemotherapy? This is the second time she develops cancer. You can make the argument that it is recurrence at the site of anastomosis, which could be insufficient resection at the primary surgery 2 years ago. Or could it be that she did have MRD, which would have been eliminated with adjuvant chemotherapy? The patient, if we go strictly by the guidelines present before ctDNA MRD testing, she would probably get some adjuvant chemotherapy, 3 versus 6 months to be determined. But now that we have this data and we know that we can test her to see if she has any MRD using ctDNA, using her specific gene sequence from the original tumor, this might save the patient 3 or 6 months of chemotherapy. It will prevent exposure to cytotoxic or myelosuppressive chemotherapy that can increase her risk of contracting infections, especially COVID-19. So we went forward and proceeded with ctDNA testing. We're still waiting on the results of that, but it will be the determining factor as to whether she needs some adjuvant therapy. The patient was very excited with this prospect. The fact that she might be able to avoid chemotherapy altogether is something patients are always looking for, and we are looking for it as well.